When you get something like fentanyl, it's much, much, much more potent. It's a fairly small molecule. I think it's only 2 mgs will kill the average person. Lethal dose is fairly small. And what makes it especially insidious is it's pretty easy to synthesize too. It's not an isolate. It's made from other just small molecule synthesis. It's only a 4-step process. So it should be shipped in small amounts. It's highly potent and it's easy to make as well.
That's right. I think that's what people don't understand is I think the general notion out there is like fentanyl, it's a synthetic molecule. It must be very difficult to make. Where's it coming from? Whereas heroin, it's more kind of natural based. Mm-hmm. But it sounds like it's the other way around. Okay, let's start with basics.
Yes.
So what is an opioid or an opiate? Or what is the difference?
The opioid is the natural version of these things. It operates on the mu-opioid receptor, if I'm not mistaken. Is that correct? Actually, you might know this information better than I do.
Yeah. Well,
the opioids are the synthetic variants of these.
That's right.
So effectively, where all these things come about is we're looking for pain medications. People have been looking for pain medications for years. Mm-hmm. So they started with, especially in World War I, they found morphine. Morphine is an incredibly effective pain medication, but led to huge overdose issues.
Morphine did?
Yeah, morphine did.
That's interesting. But even before morphine, I guess we had like opium?
Yeah, opium as well.
Goes way back, right?
Yeah, exactly.
Yeah, and it's all derived from the poppy seed?
Exactly.
Right? And so like we hear about opium, we hear about heroin, we hear about morphine. Maybe talk us through like what are the differences?
So I'm going to start with the morphine because that's one of the first ones that people really use for pain. Okay. World War I, all the soldiers coming back, they'd give them morphine for pain in this. And around that era, it was commonly used and had so many addiction problems. So this is kind of unfortunately the birth in some of the pharmaceutical industry. They started looking at modifications of the drug. So they looked at doing minor chemical modifications, and one they did turned it into a molecule which actually turned to be heroin. So what heroin is, it's a minor modification of morphine. It actually has it binds the same groups as all it does is it helps cross the blood-brain barrier that much quicker.
That's interesting. I didn't realize that. I just somehow assumed that heroin was always designed as a recreational drug, but you're saying that no, it was a pharmaceutical. It
was originally designed as a pharmaceutical. In fact, if you look at some of the old pictures, and I'm sure we can get a cut of what these things look like, they market for all kinds of different ailments.
That's right.
So it's actually marketed as an old pharmaceutical. And what it basically does is it gets into the body, it crosses the blood-brain barrier that much quicker, and then it hydrolyzes back to morphine, and then that's why you get the activity. So it's like a super potent morphine derivative.
Interesting. So what makes it more readily used as an illicit drug is the fact that it gets into the brain more quickly.
Yes, exactly right.
Gotcha.
Exactly right.
And what we know about substances of abuse or things that are used more recreationally, typically it's things that come on very quickly.
Exactly right.
Come off very quickly because that's how it's most reinforcing.
Exactly.
So in some ways, heroin is more lipophilic.
Lipophilic. It's basically what's dissoluble in think of it like greasier. The greasier these molecules are, you can think of like oil and vinegar, right? The oil, we think of the greasier molecules. Vinegar, you got more of the water hydrophilic molecules. So you need to be on that sort of hydrophobic side to help cross the blood-brain barrier. Yep. That's what heroin is. It basically removes some of the polarity of morphine, crosses the blood-brain barrier that much quicker, and then it just hydrolyzes back to morphine and then acts just like morphine does.
Interesting. Okay. So acts more quickly in the brain.
Exactly right. Got you.
Okay. So I guess from a pharmaceutical perspective, is that why it was not used? It was found to be more
addictive. It is more addictive. They found it to be stronger. Heroic actually is where heroin comes from because it's so much more effective and so much. But because they marketed it for a broad variety of different ailments, they found the addictive qualities were that much more significant, which is why they kind of ebbed it out.
Got it. And how does heroin then compare to opium?
Heroin should be much more, if I'm not mistaken, heroin should be more potent than opium.
It is, more potent, yeah.
Again, I think as you say, it's the faster mechanism of action, getting the brain faster. And I think it's more specific, if I'm not mistaken, on mu-opioid receptor, which is all these things interact with.
Okay, so that was heroin.
Yes.
And then where do we go from there?
So one of the problems, as you probably well know, is pain medication. Pain is a really hard thing to medicate, as I'm sure you know. So on the chemistry side, they're always trying to find new pain medications, things that are good for ameliorating pain response, but don't have the addictive qualities to them.
Right.
So there are a whole bunch of different molecules that people are looking at. They went away from the pure natural base, like the morphine, and they went more of the synthetic bases, things that mimic the basic structure, but you can synthesize fairly readily. And this is in the late 50s, early 60s when the fentanyl type molecules brought into place.
Right.
And they're incredibly effective. These are way more potent than the morphine and the heroin derivatives.
And where does hydromorphone fit in?
Chemists play the same tricks with most molecules, where they take a core molecular structure, they make minor modifications of these to look at the overall, how effective they are. And they probably found, okay, it's the same core structure. It has probably not as addictive qualities as the morphine. It depends on which of the receptors you're hitting, how tightly they're binding to these receptors, how fast they disassociate from the receptors as well. So it's what's called structure-activity relationship studies, where you look at the core molecule, you make a little minor structural change, you see what the biological response is, you keep making these little tweaks, and probably hydromorphone is just one of the various derivatives that I looked at, which has that perfect, I wouldn't say perfect, but good for helping people off some of these drugs as well.
Yeah. Okay. So fentanyl came on the scene in the 50s.
Yeah, late 50s. Is developed in the 50s, late 50s, early 60s.
Yeah.
Fentanyl itself is much smaller than morphine. Chemically, it's much, much smaller. And just as a generic how these molecules work, you can think of like a baseball player being an enzyme and the Mitt being the active site. So you can think of something like morphine as being a softball. It's a fairly big thing. If you have a regular baseball mitt, it's not the easiest thing to catch, but you can kind of catch it in.
Is the baseball mitt the receptor that
it's like the receptor? Like you think about the mitt like the receptor, and you can think of the baseball, the softball as being the actual drug target itself. So if you have something like morphine, it's fairly big. It kind of binds to the outside. As you imagine trying to catch a big softball, you're not going to get quite into, but it fits pretty well, but you're not going to get in as effectively. Not all molecules are going to fit in this receptor. If you tried to kick a soccer ball at the mitt's not going to be effective. It's just not going to bind to the receptor. You can think of, fortunately, fentanyl's like a baseball into the baseball mitt. It fits really nicely, sort of deep into the pocket, and has a really good binding coefficient, which is why it's also such a strong drug.
Got you. So that's when we talk about receptor affinity.
Exactly.
So it has high receptor affinity, exactly, so low K coefficient.
Exactly.
Right? Okay.
Exactly. Okay. And the other thing about fentanyl is it's fairly lipophilic as well. It's greasy of a molecule, so it crosses the blood-brain barrier very effectively. It's small enough it can bind quite deeply into the pocket. It kind of mimics some of the core structure of the morphine, but just smaller, can get into the pocket and bind more tightly. Okay, so a couple of components so far. One is that it has high affinity, meaning that it binds very easily, readily to the receptor. Yes.
Given its size and shape.
Exactly right.
Two is that it's very lipophilic or greasy. So it goes into the brain similar to heroin very quickly. Now, it binds to the receptor, but it also activates it pretty readily as well, right? Is the amount that it activates the receptor, is that different than other opioids?
I guess, again, this is outside my field of expertise, but my guess would be yes. My guess is because of the binding, because of the acts and the effectors, receptors, absolutely would be my guess.
So the intrinsic activity is higher?
Yes.
So we have a molecule that on several accounts is just works that much more effectively.
Exactly right.
Gets on quickly, works, has more activity once it binds, and it crosses the blood-brain very quickly. But also has a relatively shorter half-life, compared to morphine.
No, I actually did not know that. That's actually kind of interesting. Yeah.
So in that sense, it's even quicker on, quicker off, in the sense that...
My guess is just hydrolyzes quicker. The metabolism of the drug must be faster in that process as well. It's probably easier to break down. It's easier to excrete out.
Okay. All right. So now we have this dangerous, well, in some ways dangerous, but also very effective molecule for treating pain.
Yes.
But that for the same reasons as heroin, it's actually that much more addictive as well.
Exactly right. Like, as you well know, hospitals use fentanyl all the time. It's a very good anesthetic. It's very good for those things. But again, like a lot of the other good pain medications, they started giving it as patches. They started giving it as other kind of more public use aspects, and then you built on the addictive market, and that's kind of where a lot of this thing kicked off.
That's right. And I think something we should remember is that there is a place for fentanyl.
Yes.
It's a very effective, fast-acting pain medication. You break your leg, you're in excruciating pain, you're in the OR, or you're in the emergency department. A little bit of IV fentanyl can go a long way to get you comfortable.
Yes.
it has many applications that are safe and important and effective.
Yes.
But like most medications, if used inappropriately, can cause problems. So now this shift from heroin to fentanyl in the illicit drug market was interesting.
Yeah.
And for some of those same reasons, because you're saying that it's very potent, so you need much less of it.
Yeah, and one of the problems we had, especially in Vancouver, is you can bring it through the mail. Things like heroin, things like morphine, you need a fair amount of the material for actually people to get the equivalent high. Mm-hmm. So you need a lot of it. So shipping it in, that's why you always see these big kilo bricks of it in the news stories. But fentanyl, it doesn't take much, and it just takes a little bit in an envelope, and that's all you need to do.
Yeah,
and
that's right.
It's really easy to import in.
I mean, we think of it as about 100 times more potent than heroin, 50 times more potent, or morphine, 50 times more potent than heroin. That means you need 50 times to 100 to 50 times less of the substance to get the same effect.
Exactly right. Exactly.
Meaning much easier to smuggle, to transport. But also, like, that aside, for heroin, you start with a poppy seed.
Yes.
Right? And that's usually cultivated in the fields in the Middle East.
Exactly.
And it has to be processed there, packaged up, transported across the Middle East, across Europe, across the ocean, into North America. That's a huge process. And we're talking about like large quantities.
Exactly right.
Right? Whereas fentanyl, I mean, the packages go way down, but also turns out we can just synthesize it here from scratch, essentially.
Yes, the precursors, unfortunately, are fairly common for a lot of other different drugs and molecules as well. So there are a lot of very legal chemical companies making a lot of the precursors because you're going to need those for other commercial products. So it doesn't take, a little bit of diversion of the precursor market leads to fentanyl abuse and
to a lot
production.
of fentanyl.
Yeah.
How sophisticated of a lab do you need to create fentanyl?
It depends on how far in the process they get the precursors.
Okay.
It's a couple steps to make the actual fentanyl molecule itself. My understanding is most of the labs bring in a late stage precursor and then they do the final step, and you don't need a very sophisticated lab to do that. To do all 4 steps, you actually need a fairly sophisticated operation to do this. But if you want to do 1 or 2 steps of the process, it doesn't take much.
Let's just say the precursors that are commercially available.
Yes.
And we don't need to go to the specifics, obviously. But, well, I guess it's publicly understood now. What are the precursors that you need for fentanyl?
It depends, again, how far back you want to go. Like, you need aniline derivatives is one of them. Depends on the fentanyl derivative you're dealing with. Aniline. You need a piperidinone, which is kind of the core of the fentanyl. You need a phenethyl group, which is the sort of the tail at the end. And you need some kind of propionic anhydride as well to get the amide bond to form. So usually what people do is they'll make the amide bond last, and that's a fairly simple, straightforward step to do. Mm-hmm. And then they'll bring in the core already constructed, and they'll just bring in the last. Going from an amine to an amide for all the Chem 233 students out there is actually a fairly straightforward process. Some of the earlier steps are a little bit more tricky, but again, unfortunately, these drug operations are getting more and more sophisticated. So even those steps, if you have the proper equipment, it's not that hard to do.
Right. So, okay, let's just say, hypothetically, obviously, I wanted to set up a lab and create fentanyl.
Yes.
Could I buy the equipment I needed and the precursors just off the market right now?
They're all regulated in Canada. So because of the fentanyl problem, they're all regulated as Class A and B precursors. So it's hard to get your hands on some of these. One of the interesting things for random trivia is one of the difficulties for the drug lab isn't the drug precursors themselves, is the fact most of them aren't properly ventilated. So that's why you get so many drug fires, because they're heating up the solvents and they don't have the proper heating and the proper ventilation. And that's actually what causes a lot of those fires. So it's actually really need it's more than just the stir plates, the heat. You actually need the proper infrastructure to do this actually any bit safely.
So, yeah, exactly. And I remember when I used to work in the burn unit, I work primarily in the emergency department now, but, a few times a year we'd get people they would have methamphetamine labs that would blow up on them.
Exactly.
You'd see horrible burns.
Exactly.
But it sounds like with fentanyl, it's a similar process.
It's a similar process.
Danger,
you're going to have, my guess is you're going to have worse burns than the other ones, just because the scale of what you're making is that much bigger. So their operation
with methamphetamine.
With methamphetamine, you need to make a lot more of it to actually make a profit, my guess, for those groups. So it's a bigger scale operation, and when those go bad, then you have a much, much bigger fires. With fentanyl, again, if you only have a lethal dose of 2 milligrams, you can do a lot of things on smaller scale without quite the problem.
Interesting. Okay. And do you need to be a sophisticated chemist, or can people sort of, if they get their hands on the equipment and they get, on the gray market, you buy the precursors?
Well, this will be my anti-drug messages. Making the molecule is actually not that hard. Purifying it is. So it's horrific probably what's actually on the street drugs in terms of the impurity profiles of a lot of these. If they don't know what they're doing, the impurity profile, the toxicity of what else is in those things is going to be pretty bad. Just because anyone can mix chemicals together. Anyone can it's like following a recipe. You take things, you mix things in, you add the chemicals. But the real challenge of chemistry is not just making the molecule, knowing what to combine. It's actually purifying it. How to get the thing out pure. How do you make sure that you don't have any of those other precursors left over? It's actually removing all of those. You just have one material.
Well, so now, what are some of the impurities and contaminants that you might see in just street synthesized, amateur synthesized fentanyl?
My guess, again, the funny thing is I don't actually deal with what's on the street. I'm not 1,000% sure. But if I were to guess, it's they wouldn't drive the reaction to completion. Right. So every step you have a little bit of the precursor of the last thing. Like if you need an aniline, at one point you need to do a reductive amination to get this thing. Again, 233 students should know what that is. But if you do a reductive amination of the reaction, you're going to have the aniline component there. You're going to have a little leftover prepared known because you haven't purified them out. Then you do the next step in the process, and let's say you already have the phenethyl group attached, depending on how you do it. You do an acylation, then you're not only acylating the thing you want to acylate or make the amide, you're going to make an amide of aniline as well. So you have a whole bunch of it starts to become a bit of a mess.
Right. So what you're saying is that as you're doing the reactions, some of the precursor will sort of remain, the reaction. Right. Or the sort of midway products will remain because the reaction is not going to completion.
Exactly.
So and then you take all of that, you put into the next reaction. So you just have compounding contaminants.
Exactly right.
And the downside of these contaminants, why would it matter?
Oh, because the toxicity is probably pretty bad of those as well. I mean, I'm not just saying fentanyl's bad, but you're not just taking fentanyl. You're taking fentanyl and all the impurities left over.
And that's what people don't realize.
Oh, right? I know. It's horrible. Yeah. This is an analogy, actually, when I give my do not do drugs to my second year class. Pouya, think of yourself when you were a second year student doing organic chemistry labs. Think how bad
I felt and the anxiety before the exams.
Again, didn't have the right professors to calm you guys down.
That's right. Okay.
But think about your lab results. And those are fairly straightforward labs. Those are made to make sure most people can do them through. And think of the impurity profiles you did as you were a smart, trained undergraduate doing chemistry in a trained lab, and you would never eat any of that stuff. So think about people without even that level of training doing this kind of chemistry. It's all kinds of horrible things left over in there. Toxicity profiles we don't even know yet, long term especially.
And that's another good point you make, because I don't think anybody's really looking at the impurities right now.
No.
Well, your research is, but when you think of drug checking services, they're not looking at the impurity profiles, right? So we don't know because we see all these crazy toxidromes when I treat a patient in the emergency department. We see our patients are very sick, and we know that what we're seeing is beyond just the fentanyl effect, but we don't really know what else is. And it's interesting because I think the research that we're doing together may answer some of those questions.
Oh, it'll be quite exciting. Yeah, very exciting.
Yeah, and hopefully will help us treat our patients more effectively if we actually know what is actually impacting them in terms of pharmacological perspective.
Right. It's funny, a while back for one of my classes, I did a lot of research into how are these things made on the street, because I was curious. Right. And I'm sure the RCMP now has me phone tapped.
That's right.
See how these things go.
Me too. But for different reasons. Just kidding.
But some of the synthesis, some of them are really, really bad. Like some of the things, like what I'm talking about is a clean synthesis of these. But some of the makeshift things people do to do the same kind of processes, the impurities in those, heavy metals, you name it. It's acidities, the acids they use. It's pretty bad. It's pretty bad.
And for lack of a better term, there's no real quality assurance process in these illicit labs, right?
At all.
In fact, I would say, you probably know this better than me, but probably in a lot of commercial natural health product labs, they don't have great quality assurance kind
Not
of
at
process.
all. No, unfortunately, a lot of the natural health products you see, in fact, you randomly see it in the news, like someone has trouble because the active ingredient was just that much higher. There's very little control over
and that's
those markets.
That's like a professional pharmaceutical.
That's a professional market.
Right now you have these dudes that get this equipment and like a cookbook and they're cooking fentanyl.
It's you're using a cookbook. If you use a cookbook, you don't know what you're doing.
That's right.
You don't know exactly how to do it because you're trying to follow some recipe.
Yeah.
But it's a complex process, and not knowing when the reaction's actually done, not knowing if you've added too much of something, and the consequences of adding too much of something in terms of the next steps, impurity profiles of the next steps. Like, you really do need to be careful if you want it pure.
Yeah. So, I mean, it's just interesting to think about because, like, the actual pharmaceutical grade fentanyl is dangerous.
Yes, absolutely.
And what's synthesized in the street is that much more dangerous. Now, okay, so there was fentanyl, and then we went to fentanyl analogs.
Yes.
Like carfentanil.
Exactly.
And like, what makes carfentanil that much more dangerous?
I think, if I'm not mistaken, it's just that much more potent. Like carfentanil is, again, what chemists will do. Actually, this is how every drug is made, which is you have a basic hit, like fentanyl. You know the basic activity of the molecule. And then pharmaceutical company want to improve a factor, make something better, make something worse. So you do minor structural modifications of the core. And you're going to, again, you look at the biological effects, you make a minor modification. And you kind of learn, in the sense, it's a way of, on a chemical perspective, seeing what that pocket kind of looks like.
Yeah.
Where can pockets, they have little pieces that like water, that pieces that like grease better. And by playing with the structure, you get a pretty good idea of what's greasier in the pocket, what's going to like water, the hydrophilic parts more of the molecule. And the bad news, of course, is when they play with these, you're going to find things like carfentanil. I think carfentanil is used, if I'm not mistaken, as an elephant tranquilizer. It's just that much more potent. And it's not that much different than fentanyl. It's a little bit of a modification to the molecule. But it just leads, again, it just fits that pocket just that much better. And it's just that much worse for you.
Well, okay, so we talked about fentanyl and carfentanil, fentanyl analogs. But there's like a whole nother class of opioids that we're starting to see. We see them in clusters in North America, but I think they're even more common in Europe. When my European colleagues tell me, those are nitazines.
Yeah, right.
So tell me a little bit about nitazines.
They're basically small molecules, just kind of like fentanyl as well. They're fairly easy to make. It's a couple steps. And again, they're these modular synthetic molecules. So you can not just get the core nitazine, you can get also synthetic variants of the nitazine for these molecules. Again, it's very, very similar to the synthesis of different steps, but similar kind of length that you'd need for fentanyl. So you don't need much of it. It's a pretty easy modular approach to make.
Right. And it's interesting to think because it's like they were never approved for humans or animals, from what I understand. They're very potent, more potent than fentanyl. They seem to have a longer half-life, we believe. So it's interesting to think, like, why would this even exist in the drug supply? And I suspect it's just like one other source of a potent, fast-acting opioid.
Exactly right. Not approved for humans. I don't think they care.
That's right.
I just think they're looking for anything to give their drug brand a different kind of selling point on the street. And these things are horrific, just like most of the other ones. Yeah,
and like maybe like as like some precursors are more controlled, then you sort of
exactly expand out your precursors. This is completely different precursor based than fentanyl. None of the components are the same. Maybe, as you said, it's actually a good point. As fentanyl precursors are clamped down, they start looking for other molecules they can make that can have the same kind of efficacy.
Yeah. And maybe different labs with different chemists, different locations, different access to precursors essentially create different molecules that have similar effect. Some of it, I've heard, maybe there's some engineering around, okay, we want something that's a little bit more sedating or a little bit more longer acting. So that's why you see like benzos added to them, alpha-2 agonists. Are we testing for nitazines right now in the drug checking?
Not that I'm aware of, no. The problem with all the drug testing is we're always a little step behind.
That's right.
Right. It's hard to develop the protocols to actually get them implemented in all these different groups. It depends on the equipment they're using. You got to make sure you calibrate them for the particular signals you're seeing. And then not just nitazine, if you use nitazine or a nitazine analog, a minor structural component will start looking different on a lot of the drug testing devices too.
It's like we're always a few steps behind because it makes me wonder what else is actually out there that we're not checking for.
Right. Unfortunately, against the lagging indicator, we'll find out probably in a couple months. We're just that little bit behind for all the drug testing right now. And there's not actually a reflection on against the drug testing sites. They're doing an amazing job with the resources they have. It's just we need more resources in that area for better, quicker analytics or better ways to update their analytics.
That's right.
As quickly as possible.
Yeah. Let's talk about methamphetamine since we brought it up.
Absolutely.
I mean, it is also an epidemic, you know,
absolutely.
and it's a horrible drug, and it doesn't get the same exposure in the media as fentanyl right now because you don't necessarily see overdose deaths associated with it like you do with fentanyl. But the impact it's having, the lives that it's destroying, the psychosis that's developing as a result of it.
What's the average dose, just out of curiosity, for methamphetamines? Like, how much do you actually need to take for the average user?
So the unit from sort of street language would be 1 point, which is roughly 1/10 of a gram.
Okay.
So typically, like half to 1 point would be the lowest amount somebody might use, and then it just goes up from there. Some people use like a ball, which is like 3.5 grams a day. I just want to quickly touch base on something because we did a whole episode on sort of the track and trace research that we're doing around detecting, but because we're talking, and this is something we didn't touch on in that episode, but this whole business around like all of these impurities that we're seeing in the drug supply on the street. And sort of it's not typically looked at through sort of local or even national drug checking programs, right? What is the equipment that you actually need and the process that you go through to get a full analysis of everything that might be in a particular sample, including contaminants and impurities, etc.?
The gold standard right now is something called, it's an LCMS. It's a liquid chromatography with a mass spectrometry at the end of this.
Right.
And almost every major lab, hospitals have it. Whenever you go through a blood test in a hospital, they basically send it down for all the analyte checking, and they run it through these machines.
Right.
And effectively, for sort of what it does is, in a crude sense, if you ever done the thing when you're a kid, you take like a pen and you put it on a paper towel and you dip it in water and you see the different colors dilute up as it separates out. It's the same concept. It basically just does that much more effectively with small molecules. You're basically just separating them out across the surface. And then we're looking at the molecular weight. That's what the mass spectrometry does at the end of it. So you can get the charge to mass ratio at the end, and you can get roughly the separation at very specific times, depending on what kind of columns you're using and what kind of separation devices you're using. So you can basically take random mixtures of things. You get really nice separation out of each of the individual components. And then for each of those components, you can actually figure out the molecular weights that you're dealing with. So that's the gold standard. The other thing about it compared to a lot of the other technology out there is it can develop or detect really, really low concentrations of material in this. Like infrared, that's one of the classic things they use in drug testing facilities. It's cheap, it's an easy, I don't say super cheap, but it's cheaper than the LCMS. And it basically uses infrared, and it looks at the bond vibrations. That's in a lot of drug testing sites use this because it's a really convenient way to do it. But the detection limits are not nearly as good. You can detect about 10 weight percent, 5 to 10 weight percent with those samples, where LCMS is way below that. You can detect really, really small amounts. So effectively what we're doing in this test is we're looking at not just the concentrations of the drugs, but as I said, if you do any reaction, each time you do it, you're going to have a very specific concentration of the byproducts in there. So we're looking at that low-level concentration of all the byproducts. And it's going to be very dependent by batch. If I ran it once, I might get, 1% of, let's say, aniline left over. If you did it, you might get 1.5% of aniline. Then I can use this kind of technology. Said, 1.5%, Dr. Azar ran that batch. 1%, Professor Sammis ran that batch.
Right.
And you get that kind of level of detail. The other thing we can do with these types of analyses is we're working with a specialist, Professor Tao Wan at UBC, and he specializes in really the mass spectrometry, looking at the molecular weights of these, because it gives you a really good, again, low-level concentration. What he does is something called omics, or these basically large molecule, like, for example, metabolomics. He'll work with hospitals to look for really low-level concentration of secondary metabolites to see if you can use as an indication of drugs. It uses as an indication of disease. So if you can look at the metabolic profile, you can see, again, you're not looking for one thing, you're looking for that fingerprint.
Right.
All the combination of all that impurity. What we're looking to do in the drug testing is the same kind of idea, is not just looking at the drug concentrations, but you're looking at the whole picture to look at the fingerprint. It'll tell you the batch, it'll tell you almost down by operator who actually did that reaction. You see as little impurities, and that creates again, you look at your thumb, it looks like a thumb, but you don't see the fingerprint region. That you need to go to that level of detail to actually look at being able to identify each batch as you go through.
Wow. So you can sort of differentiate different batches.
Exactly. That's
amazing.
The hope, yes.
Amazing. Okay. Well, I mean, this was super fascinating. We just hear these words all the time: morphine, heroin, fentanyl, carfentanil, nitazines. But it's important. It's really interesting to get some context around what they actually are, how they're made, where they're coming from, and why they're so dangerous. So, super fascinating. I really enjoyed learning this stuff in a way that's easier to understand. Will you come back to have another discussion later?
Oh, absolutely. I love these discussions because I know the chemistry aspect, but the medical aspect, I don't know at all. So I always learned a lot for these discussions as well.
No, it's fun. And it would be fun to sort of tackle different classes of drugs.
Oh, absolutely.
Okay, we'll do
I just want to remind the RCMP that my internet searches are for research, not for...
That's right. For any government agencies that are...
Exactly.
All right. Okay, cool. Thanks so much, bud.
Thank you so much for having me.
Okay. All right.
Thank you.